This is the first in a series of posts that I'm going to do about Cognome and about the incredibly exciting things that we're doing. And one of the reasons to do that is mostly when you talk about healthcare today, you get bad news. It's too big, it's too costly, we're not as good at providing healthcare in the United States as other countries, too much money wasted, it's controlled by insert name of group here. But really, for the very first time since I moved to the United States as a young man, way back in the 1980s, I feel like healthcare can change. The thing that has changed is technology. Healthcare is different, it requires different things, and the technology that it's needed to change has not been available, but it is now. I've been very lucky. I've worked with a lot of really talented people, scientists, doctors, clinicians of all kinds, researchers, across lots of different kinds of places, business people, in academic settings, commercial settings. And we're all working together to put together the pieces of this incredibly fractured, siloed healthcare system. Our goals are so big and so audacious that it's actually hard to give them a name. I like the name that Dr. Parsa Meharji uses, which is learning healthcare systems. Others use it too. I've heard it used by people at Johns Hopkins, for example. But Dr. Meharji has been talking about this and building systems around learning healthcare since 2018. 6 years ago was when he wrote that. Gives you an idea of how long it takes to do something in healthcare. I mean, we did have a wee pandemic in the middle there, but it takes a long time to get things done. And the work that Dr. Meharji was doing back in 2018 shows what the promise of AI and ML models were and are today. People think that it just happened today, but these things were being built and released at least 6 years, if not 10 years ago. I have personally seen the effects of them at the Montefiore Health System, where Cognome is being spun out of right now. ML models process a vast number of data points in milliseconds, vastly more than any human possibly can, and certainly more than a physician or a clinician of any kind has the capacity to do in real time. And unlike humans, where more and more data and more things to do slows you down, AI and ML models just get bigger and better and stronger and more accurate the more you scale them. There may not be any AI or ML models deployed where you seek care today, but if there aren't, there certainly will be next year, and by the year after, there is going to be an explosion of exponential growth. Eventually, these kinds of models are going to be sitting side by side with clinicians, helping them make decisions in real time. And this is one of the core capabilities that will transform hospitals into learning healthcare systems. In fact, we have a series of patents that talk about the analytic tapestry of multiple models working together to understand one another's conclusions in order to compute the best care for you. But to go back to the original question of why am I so excited and what are we going to change? This stack of technologies and these models that sit on the top of this stack are going to transform everything in healthcare. They're going to improve outcomes. They're going to lower costs. They're going to improve patient communication. They're going to reduce physician burnout. And they're going to reduce a lot of things that we find annoying so much better. We've got a lot of things that we're releasing at the moment. If you'd like to learn more, give us a call.